What is public health? Public health means promoting, maintaining, or restoring the health and quality of life of individuals in our society. Public health is important for health promotion and prevention through various primary health care initiatives, activities, policies, and/or legislations.
Primordial prevention is the first level of prevention. The aim is to reduce the occurrence of factors which in turn decreases disease risk using health policies. Obesity is a major risk factor for diabetes. Public policies can combat obesity addressing influences like energy-dense foods and low activity levels. Examples of public policies are financial incentives to promote physical activity, marketing restriction towards children such as the Quebec's Consumer Protection Act, and food labeling which can help Canadians make informed decisions. Traffic light labeling uses a traffic light signal approach to indicate the amount of ingredient in the product. According to Sachs et al., this intervention helps in weight reduction and is cost effective. This is an example of primordial prevention in everyday life.
Primary prevention involves preventative approaches and interventions that seek to avert the occurrence of alterations to health. The purpose of primary prevention is to prevent health conditions, diseases, and injury or disabilities, and focuses to reduce the diseases through lifestyle modifications. It is therefore important to incorporate a healthy diet of fruits and vegetables. An increase in activity and alleviating stress can also prevent health conditions such as diabetes. This is a prime example of primary prevention.
Secondary prevention is the third level of prevention. The purpose of secondary prevention is to detect, diagnose, and determine the proper course of treatment for the patient. This is achieved through screening processes, diagnostic tests, and interventions aimed to stop or slow the progression of one or multiple health conditions. In Canada, diabetes is a major health issue. According to the Public Health Agency of Canada, approximately 1 in 5 Canadians live with undiagnosed diabetes. Diagnostic tests for diabetes include the fasting glucose test, oral glucose tolerance tests, urinary evaluations, and more. Proper diagnosis is crucial to prevent or treat certain conditions such as hypoglycemia or insulin shock.
Tertiary prevention is the fourth level of prevention. The aim is to limit effects and symptoms of chronic conditions using rehabilitation and disease management to improve quality of life. A major public health concern is diabetes. It is a chronic condition which affects quality of life if untreated. Education for glucose monitoring at home can be implemented in this level of prevention. General education about the disease can also improve quality of life in patients and decrease unpleasant effects associated with the disease. This is an example of tertiary prevention in everyday life.
Quaternary prevention is the fourth level of prevention, and it consists of preventing any possible harm caused by health diagnostics, treatments, or other programs. This level of prevention also seeks to protect vulnerable groups such as the uneducated, elderly, and homeless. Some examples of this are cleaning needles to prevent hospital-acquired infections and performing diagnostics to make sure the patient is safe to perform physical rehabilitation.